Welcome to Health Matters with Corporate 24, where we discuss various health issues affecting our daily lives. Myself, your host, Shazan, my co-host, Tariro, and joining us today as our guest speaker, Dr. Lorraine Nyakudanga.
Welcome, Doc, to our podcast, Health Matters with Corporate 24.
Thank you, Tariro.
Doc, can you tell us a little bit about yourself?
Okay, so I am a primary care practitioner, currently working for the City of Harare as a medical officer. Special interests, medical and health education, explains why I'm here today.
Great. Thank you, Doc. So we're going to delve right into our issue. Doc, please tell us, what is cholera?
I think many people want to know what cholera is.
Chichi nombonzi cholera.
Okay.
Yes.
So basically, cholera is an infective diarrheal disease, right? Chirwere chema nyoka in Shona. So it's infective, meaning that it's infectious. You can pass it from one person to the next, and it's basically a diarrheal disease. There are other symptoms that you can get from cholera, but the main one is diarrhea.
Interesting, Shazan.
With that said, are you able to explain to us what the difference is between cholera and diarrhea?
So cholera falls under diarrhea.
Okay.
Diarrhea can be caused by other things other than cholera. So diarrhea can be caused by infective agents. So we're looking at bacteria, viruses, or even parasites. They can cause diarrhea. So cholera is a part of diarrheal disease.
Okay.
Yeah.
So at least now I know that when I go get whatever I'm gonna get eating somewhere and I have diarrhea, it's not necessarily cholera.
Yes, definitely. So for most of your diarrheal disease, like ordinarily, it's not cholera.
Okay.
So usually it happens in sporadic cases, and then you end up getting epidemics like the one that we're currently having.
Okay.
Yeah.
Okay. So tell us, Doc, what causes cholera?
Infective, so that basically means there's an organism which is involved. So for cholera, it's a bacteria. So that is what causes cholera, and as we said, it's an infective disease transmitted through the fecal-oral way, that is from human feces, excuse me for the language, to the mouth, basically. So that's how people get cholera.
That's very interesting.
Very interesting.
I think that number of people didn't actually look at cholera that way. But now that you're saying that, it widens our spectrum on the understanding truly of what it is.
So, Chiremba, you spoke about fecal what? Can you explain to me at Tariro out there, what exactly do you mean? You spoke about human feces to the mouth. What exactly do you mean?
Okay. So with infectious diseases, they are transmitted, that's me passing to the next person, right? There are various ways with infectious diseases. So for cholera, it's because the bacteria that we mentioned before, it's found in stool.
Okay.
So the way that you are going to get it in your body is via the mouth. So that's what I meant by fecal oral. For most people, it's the issue of washing of hands, right? So let's say I have cholera right now, and then I have my diarrhea, and then we share a space, maybe a home or even a workplace, right? And then I fail to be 100% hygienic, and then another person comes in after me, after me in the toilet, right? They touch the surfaces that I've touched. It's because of my fecal matter, which is infected, which is on maybe surfaces, and then you touch it, and then next time you're drinking your coffee or you're eating your food, then you're putting it in your mouth. That's the fecal oral transmission that we're talking about.
Okay.
Yeah.
I mean, at home, let's just use us for example. One of my family members has cholera. We have the same bathroom. They go in. They do flush the toilet, obviously. They wash their hands. They leave the bathroom. Do I have to fear going into that same bathroom with them, using that same toilet? Is that something that I have to be worried about?
I wouldn't say fear,
Yeah.
but cautious.
Okay.
Right? If
Okay.
you do know that you actually have a person who has cholera in your house,
Yeah.
you have to be a little bit more cautious.
Okay, so-
compared to people who don't have anyone who has cholera in their house.
So what would you suggest would be those cautious measures that we could take for an instance like that?
Yeah. So with cholera, the main thing is hygiene.
Okay.
Hygiene all the way. Washing your hands, making sure your surfaces are clean. I think on radio there was some advert about putting jik in your water, and then you use it to clean your surfaces.
Okay.
Make sure that the sinks and the toilet tank, everything that
Yeah.
people use, make sure they clean your food. The fruits and the vegetables are properly washed,
Okay.
clean water, and boiling water, depending on your water source. All those things, just the basic hygiene, but you're making sure that you're doing it to the T. That's that you will get rid of cholera.
Oh, thank you, Doc, for that
amazing.
insight. Can you also touch a little bit about water? I've often heard in conversations that we've had about drinking clean water, what we can do to make our water safe. Can I get cholera from drinking from a dirty, infected source, a dirty source of water?
Yeah, that's very possible. So let's going back to the fecal oral transmission issue. Let's say that we have a toilet which is very near to a water source, right? And then someone is using that toilet and they're infected. If that goes into the water source and then you drink it, then you can get cholera. Yeah. So your water source has to be it has to be verified that this is clean. If you're not sure, boiling always helps.
And then for those who are actually, have access to pharmacies or be it any hospitals or clinics, I'm sure you could get my water droplets here.
So with our city clinics, we give aqua tablets for free.
Okay, that's
So you
amazing.
can
So there you
just-
guys go.
Yeah.
All right.
You can just go to your clinic if they will be given the aqua tablets.
So is there anything we have to come in and say if we need those tablets
I need aqua tablets.
I just need aqua tablets. Okay, no, that's
Yeah.
fine. So I need aqua tablets, you guys. That's how you
That's
get
it.
them.
I need
But,
aqua
look, yeah. We want to be safe. I mean, that's what we're here talking about, and that's the reason why we're having this health matters, little educational podcast. So at least we're all just aware about how things are.
Okay, Doc. So tell me, what must I do if I think I have cholera?
Go to the nearest clinical hospital as soon as you are suspecting that this could be cholera. Then go to the nearest clinic or the nearest hospital. Yeah. So because sometimes cholera can be quite severe, so you can have someone die within a day or something like that, because you're losing a lot of water
Yeah.
in a very short space of time. So as soon as you suspect that this could be what's happening to me, go to the nearest clinic or hospital.
What measures can I take in between me going to the hospital and me suspecting cholera? Are there any measures, or if I think I have cholera, then to the hospital, or the measures that I could take?
So
Oral,
the main thing with the cholera or diarrheal diseases is you're losing water. Yeah, and basically that's what kills you. It's because you lose too much water. So the basic thing here is or a solution, right? It's easy to make. We also have clinics giving sachets to mothers who come to have their kids immunization. But then you can also make ORS solution at home. 1 liter of water, make sure it's clean water, right? And then a 1/4 teaspoon of salt, and then 6 teaspoons of sugar. You shake it. That's your ORS solution. It helps to replace the water that you'll be losing, and basically that's what we're trying to do. Put back the water that you're losing.
Oh, you heard it, guys. Visit your nearest healthcare facility if you suspect that you have cholera, and also put in measure the oral solution. Yeah.
So Doc, I wanted to ask you, ndoziva sei kuti cholera chichinyatsondiudza kuti I have an issue, this needs like medical attention now.
Okay. So for us to confirm that you have cholera, we actually have to run tests.
Okay.
But then for you to be suspicious when you're at home, if you're having like a severe diarrhea, right? Maybe you've had like 5, 6, 7 episodes of diarrhea in a very short space of time, maybe within a day or something like that, you should be worried. Because with these ordinary diarrhea, sometimes you get 3 or maybe 2, episodes. But then if you have something upwards of 6, 7, 8, then you need to start suspecting. So there's what we call rice water, but then some people might not be able to really pick it and say this is rice water. But then for us medically, there is a typical diarrhea, which when we see, then we start suspecting that this is. But then for
my mind is already giving
but then think of rice water, right? Rice.
So you're encouraging us to.
If you can look at it, and then you can actually you can and then come in and say, my diarrhea, I think I had off an rice, right? Okay. And then I've nasan daitaka 10, right? Yes, right there we're starting to think of cholera. And then also have you had like contact, right? If your sister has cholera and is in the hospital, definitely and then you start having diarrhea and you need to think. And then right now there are certain areas where we've been having more cholera than others. If you're coming from such a place and then you start having diarrhea, definitely you have to be suspicious. So all of these things, numerous episodes of diarrhea, be suspicious. Go to the clinic. Yeah.
Pane mama symptoms that to look out for. When you have cholera, would you vomit? Would you have a temperature?
Yeah. So for most people it is diarrhea.
Yeah.
But then other people also get vomiting.
Okay.
And then other people will also get like a tummy ache. They'll get muscle cramps. Okay. Right.
Alright.
A fever, not so commonly, but then the diarrhea, the vomiting, and the muscle and the tummy pain. Those are the common ones.
Okay, doc. Chinozoita kuti munhu azorasikirwa neupenyu kana atori muchipatara akatoadmitwa anzi ane cholera ari kutobatsirwa tozoona munhu arasikirwa neupenyu chii chinenge chazokonzera kuti zvisvike panhano yakadaro?
Okay, so in the English terms, doc, what causes death in people who've been admitted in a clinic or a hospital, that have been admitted with cholera?
Okay, for someone who's already admitted, I think mostly it's a case of showing up late.
Okay.
Right? And not taking some of the measures that we're talking about, where you can start taking ORS solution at home, because it also helps. It's the rate, or it's not as fast as when you get a drip, but it helps, right? Especially in terms of saving lives. So, and then medically, what kills cholera patients is basically dehydration, right? Because the human body is made up 60 to 70% of your body is water. So when you lose water, you're losing quite a big part of your makeup. So when you lose all of that water, and you lose a lot of water with cholera in a very short space of time. So the dehydration is what kills people basically with cholera.
Is it necessary for us to drink lots of water when we then find out that we've got cholera, or does it have to necessarily be that sugar and salt solution, or
Okay. So when you're with the diarrhea, you're also losing what we call electrolytes. All right.
Okay.
So with the salt, with the ORS solution, you're also adding those. So if you're having water, you're just replacing water only, but then you're also losing electrolytes with your diarrhea. Okay. So we encourage the ORS solution because it also replaces the sodium and the chloride, which you're also losing.
Okay, doc. So in a nutshell, please could you explain to us what we could possibly do that could save someone's life that would have contracted cholera?
So Chiremba, tsanangurirei muchidimbu kuti nedzipi nhano dzatingatora kuti tikwanise kuzvidzivirira kubva kune cholera?
Pachirungu zvinonzi prevention is better than cure.
So
utsanana so zvatambotaura kutanga ngati make sure everything is clean and wash your hands, surfaces are clean, boil your water, cook your food thoroughly, all of those things. Kana warwara, right, you've had multiple episodes of diarrhea and you're vomiting a lot, right? Uchimwa ORS solution yako enda kuchipatara kana kuti enda kukliniki iri padhuze newe. So that's basically cholera. We don't have to lose lives, right? This is something that we can easily treat. So let's take care of ourselves.
You heard it, guys. Let's wash our hands. Let's be hygienic. Let's cook our food thoroughly. All right. So as we conclude our podcast, Health Matters with Corporate 24, would like to thank you so much, Dr. Nyakudanga, for giving us an insight on cholera. Cholera is a pertinent issue in our society, in our community. I personally know people who've been affected. I think everyone here has been affected in some way by cholera. And I think you've given us very, very, very beneficial information. So thank you, Doc.
You're welcome.
All right, guys, you've heard it all for yourself. Like Tari, my co-host, was saying, thank you then again, Dr. Nyakudanga. Let's hope you took, what we need to take home